So, hello, and a very warm welcome to this key question and answer session with Tim. My name is Joanna Taylor, and I am Director of Noigroup, and I'm joined this morning by my good friend and Principal Noi instructor, Tim Beams. Tim and I have been working together for nearly 15 years, and during this time he has taught literally hundreds of Explain Pain courses to thousands of clinicians all over the world. Tim is an active clinician himself, specialising in complex and persistent pain. He's also founder of Le Pub Scientifique and co-author of the GMI Handbook with David Butler and Lauren Mosley. So, Tim, welcome.
Hello.
Lovely to see you. So, without further ado, we are going to this morning be answering 3 key questions. And then once we've answered these questions that I will pose to Tim, then if you would like to put questions of your own into the chat or the comments, we'd love to take questions from the floor. So the questions that we're going to be posing this morning are, first of all, I don't have the time to explain pain, what do I do? My patients aren't interested in learning about pain, what do I do? And how do I get started explaining pain? What do I say? So, Tim, should we go with the first one? I don't have the time to explain pain. What do I do?
Yeah. So first of all, hello everyone. Thanks very much for joining us. We should probably say this was a question from this weekend, from this weekend's course participant. So thank you very much, Marketa. It was. Well, the first thing to say is it depends on what you think Explain Pain is. So if we were to give someone a sort of potted perspective of pain neuroscience as we understand it, then very, very frequently you won't have enough time to be able to go through it. So I think that would be fairly accurate if that was what your understanding of Explain Pain was. My understanding of Explain Pain is utterly different to that. Certainly now, maybe 15, 20 years ago, oh God, is it that long? Yeah, almost 20 years ago, then it would have been like that. And I remember designing a pain program actually that we ran over 6 weeks, and we went into lots of detail about pain neurobiology, and not many people have the luxury to do that. So what I would say is, if you're struggling with time, which many of you will do in the various different systems that you work in, education for me comes in a number of different ways. So there's some simple things like just recognizing the need to listen to someone, give them time to share their story, validate the story, understand the need to work on and build your rapport with each other, so the therapeutic alliance that lies between you, figure out what the space is that you work within, so that third space. Now all of that doesn't take time in the moment, much time in the moment. So I would say that you're doing an effective job of starting an Explain Pain process. And then education for me might come, if you do physical examination, might come through and within your physical examination. So, simply just feeding some results back, feeding your findings back would be, I think, an effective Explain Pain strategy. So a sort of simple answer to, and I think it's a really common perception for many people, I just don't have the time, is actually Explain Pain. It might be something a bit different to what you think it is. And actually there are a number of very, very, I want to say simple, because they're not always that simple. Being able to take time to listen is a skill that you can build. And not just to open up some space and allow that person to share the time, but to really show that you are listening and you're hearing them, and you're on the same page. So there's some really simple things that you can do. When it comes to pain biology and sharing some pain biology, there's some fairly effective ways of us communicating pain biology using stories and metaphor that again, it doesn't take an awful lot of time. So that, however, requires a bit of practice. Like anything, if you have learned to do some specific physical examination or a particular treatment, you no doubt will have practiced this many, many times before. And if you're sharing an anecdote, a metaphor, if you've got a story around pain, it requires a little bit of pre-thought, a bit of practice, a practice in the moment as well, and reflecting on it. So, learning from when things have gone really well for you, and then you're more efficient with your time when it comes to it. So yeah, I hope I would say that's a start of an answer about having the right amount of time. And then, oh God, Joe, now I feel like I'm getting going now, but I don't know who's joining us exactly. So the different professions, but different professions have different amounts of time as well with people, don't they? So I feel really, really privileged that I have quite a long time with my patients.
How long would you have, Tim?
I give myself an hour. So I found it really difficult, actually, fitting what I felt I wanted to, how I wanted my therapy to look, that suited both my patients and me. But financially, that isn't necessarily the best method. So if you have your own clinic, for instance, then that might be a bit of a struggle. If you work within a specific health system, you might have very specific amounts of time. So for a physiotherapist, it's common to have 20 minutes, 30 minutes, and not that common, but some people do have a bit longer. And then other professions have different amounts of time as well with the patients. So a GP, for instance, would have a very short amount of time. But I think one thing, if you don't have very much time, is to recognize that you can do a lot of harm in that time, by saying some throwaway things, some silly things. I think you can do a lot of harm. So another part of how I would see explain pain is just recognizing how your communication, including your words, can be harmful. So time is
developing confidence in that what you are saying is having a positive effect, rather than the risk of it doing harm.
It's that, and it's reading the situation and looking, being able to interpret what's going on with that person and check in with them, because we do say things because we think it's an effective message.
Yeah, of course.
And it doesn't always get received well, or perhaps the way that we've communicated it hasn't been right for that person, and then we've got to find ways around that, not only just interpret it, but find different ways around that as well.
Just coming back to what you were saying about the stories, one of the resources that we do actually provide, free resources that we do actually provide from Noi, are pain stories, and there's a whole series of pain stories that illustrate different target concepts and ideas about pain. And Tim's written a lot of them. They've been written. The ideas have sometimes come from people on the courses, real life clinicians in real life situations, and we've written these resources to help you. So we'll be dropping some of those into the Noigroup clinical discussions Facebook group, which I'll drop the link into the comments in just a minute.
Yep.
So please do come on in and join us in that group. It's a private group, and it's really for us to be engaging with our audience and to get to know people who are coming on our courses beyond the course itself. We're trying to actually continue that communication beyond the 2 days or the 3 days that you're actually on a course. We want an open dialogue, don't we, Tim?
Yeah, I mean, I think the big thing to say there, Joe, is we always felt that 2 days with people wasn't enough, and we want to support people in their growth as a clinician, and you know, overall, we just want pain therapists to be in a better place, don't we? So
100%, and we're actively creating resources to support people in their clinical work. So I'll drop the link in, but please do come and join us in the group. It's just getting going, but it's going to be really big when we release it out to the general, to all our contacts. Okay, so moving on, Tim, that was great, thank you. Next question is, my patients aren't interested in learning about pain. What do I do then?
Yeah, again, this is a very, very recent question. And I mean, the first thing to say would be, is that your assumption that none of your patients want to know? Or is that what they've told you? Because dependent on the answer, you know, it's very, very different for us. So, you know, if your assumption is your patients don't want to know about pain, that may well be true, but I think you need to ask them. And it's a very, very simple thing that we do on our courses, don't we? Where we ask you to ask your friends, family, patients about pain, just to open up a dialogue. That it's as simple as that. You're not looking to give any answers. You're just opening up a dialogue and finding out whether, you know, what people understand about pain. From that point, depending on what you hear, you can open up a number of different paths that you can take then. So there might be things that you want to discuss because it's really relevant for that person. It might be that they've been asking questions about a specific point. They might say that they just don't know, or the way their current understanding is going is perhaps not that helpful for them, or certainly that's how you might see it. So that would be how I would be introducing it, you know, if they. But then there are times when, and I've had a couple of patients where I say things like, we know a little bit about this, would you like to know? And then I have answers like, well, no, you're the professional, you just do what you need to do, or something like that. And that's, I mean, it tells me an awful lot about engagement and whether or not that person wants to be a sort of active participant in their care. You know, it goes along with their expectations of me and my role with them. But I would say at the right time and place, you can ask again, you can drop things in. And the beautiful thing of, for instance, people working in rehabilitation is you have time to just talk, and you can drop stories in and you can ask questions. And a part of that rapport building is just finding the right balance then, isn't it, of how do I connect with this person.
Do you ever encourage, Tim, if somebody says no, would you ever, where would you go if somebody just said no, I don't, this isn't my job, this is yours?
Yeah, it would depend in that time, because you probably had a bit of a flow with them beforehand. So it would be, oh, that's really interesting, would you mind telling me why that is? Might be one way to go. Or it might be, let's park that. And I would probably say that with them. I would literally say, okay, let's just park that for now, no problem. Yeah, move on. Next. Because you also, look, I've tried is then, and people probably can tell, you know, share their stories of trying. You know, you think but they must know, I've got to keep on telling them about pain, and that isn't the way to go. It's not an effective thing to do. You know, you're just sort of hammering in this message that they just simply don't want to know, and all they do is batten down even more strongly. And we've had this, haven't we? You know, a loved one wants to tell you what to do, and perhaps in your teenage years, you've got teenage daughters. You know, are they going to listen, or are they just going to hate you even more in that moment? So
yeah, 100%.
And that's like, look, then that's the reality. And whether or not the patient actually hates you, but you know, you're trying to build trust, aren't you? You're creating this environment that's safe for them to share information, and for you to do, for instance, a physical examination, and you can break that trust, you can break that rapport. So it's worth us being mindful of that.
That's great, and that brings us on really nicely to the next question, which is, where do I start with it? New patient, first consultation, where do I start with this, this whole dialogue and the words of explaining pain? A question we get asked many, many times about the words.
Okay, so it comes back to, it depends on what you think explain pain is, and to me it's essentially a sort of underpinning paradigm, how I make sense of pain in my clinic, in my world, if you want. And then there are philosophical models that I use to make that even more sort of obvious, the different frameworks. But to me, it would start before you see them. Maybe when they first contact you, maybe it's your communication in your literature, that explain pain, done well, the right messages about pain or what they're coming to you with. And I, every single one of my patients comes with pain, but I understand not every single patient will come to you with pain, but those that do, we've got to have the right messages around it. And then, as I was saying before, the way that I would set up my appointment or my clinic space are all mindful strategies to create, for instance, that sense of safety. So the sort of more complex answer maybe we went to beforehand is, for me, explain pain starts way before you start talking to them. However, if you think understanding a little bit more about pain would be helpful, then I would invite them. I would say things like, I know a little bit about that, or would it be interesting to talk about this more, or what's your understanding at the moment? And I have sort of my own phrases, my own patter for different people. And I have I say exactly those things. And another thing is, we're trying to do some sense making in the moment, and I do a sort of feedback process, and I say, okay, from what we've been going through so far today, can you tell me a little bit, can you summarize why it is that you're in pain and what's going on and how effective treatments have been? And so we're doing a reflective process. And for me, that's explain pain done really well. The start of it is reflection and deeper reflection. And then you can start opening up an opportunity for dialogue. Where the dialogue goes will then depend on that reflection.
Yeah. So you need to be able to draw on your own resources, don't you, to be able to decipher where to go with each individual person.
You do, but you're also led by the patient. You have your feeling in the moment that I keep hearing this, or they said that. So I have handwritten notes, and I ring words or phrases or asterisk them, or I link things with lines. I mean, it looks so archaic, maybe. I don't know. It's my mind map of my patient. So there's something that might come up again, and it might be my radiologist said this, or the accident, and this is what happened around the accident, or no one's telling me any answers. They keep saying that all of the tests are clear, but I'm still in pain. What then? And so to me, then it's sort of moving me already in where the phrases I've used is dialogue or discourse, or, to me, it's explain pain in my individual settings isn't that formal. But that's because of the way I like to run things. But some people like to be quite dogmatic and formal and go through different steps. Certainly at the beginning, I wouldn't be like that. But there might be times when you want to be very specific about things if someone has a question,
Mm.
then you can spend some time.
Yeah, fantastic. Thanks, Tim. And actually, one of the things we're just going to wrap up now, unless there's any questions that anybody wants us to answer live, which we'll be very happy to do. But this Q&A session that we're doing here is around these three key questions, and we're actually going to invite different NOI instructors from around the world to answer these same three key questions. And I think that we'll get very different answers, because there's just so many different flavors of explain pain and how it is applied in the clinic. And hopefully, you will find something that resonates with you, and points that you can take away from the different instructors. So just to say again that these sessions are going to be run through the Noigroup clinical discussion group, which is a private group on Facebook, and we'd love to welcome you in. It's completely free. There's going to be loads of free stuff going in there, which will hopefully help to support people who have been on our courses or who are thinking of going on a course, just to support them in their journey of becoming a better clinician in whichever way they want to. So I put the link in the chat there, and I think we can. Anything final to say, Tim, on that before we head off?
Oh, well, lots. But I was just thinking when you were saying we'll ask different NOI instructors, it would be really nice to ask some of the audience as well.
100%. Yeah.
I would like to hear where you guys are going. And the other thing is, look, my answer today, I mean, it will be different tomorrow and next week and next year. And I think it's worth us revisiting, because we just want to get better, don't we? We just want to.
Yeah, absolutely. That's what we're here for. Okay, guys. Well, thanks ever so much for joining live. It's been great to have people listening to this, and hopefully we'll see you again in the Facebook group. Take care and have a good rest of the day.
Cheers.
Bye.